times the daily allowance that is advised. Even worse, he believed that taking 2 medications daily was helping him. Chronic B6 poisoning was the actual cause. Vitamin B6 can build up in the neurological system over time, harming the sheath that surrounds your neurons, much like removing insulation from a wire. In contrast to other vitamins that just wash out in urine, the outcome, lack of coordination, tremors, muscle weakness, numbness, and even memory problems. The nerve damage may become irreversible, which is the most frightening aspect. Many elderly people mistake these symptoms for early dementia, arthritis, or aging. However, they can actually be living with a neurotoxic illness that is silent and avoidable, brought on by a medication they believed was beneficial. Mr. Carter was fortunate. His equilibrium never entirely restored, but we were able to stop the injury from getting worse since we identified it early. He now limits his driving and uses a cane. He told me that I believed I was safeguarding my brain. I was poisoning it without realizing it. This is the reality. High amounts of vitamin B6 should never be used by older persons without a doctor's supervision. For seniors, the safe daily dosage is between 2 and 10, and even that is dependent on kidney function, nutrition, and other drugs. Nobody warns you that store-bought brain vitamins, particularly those marketed to the elderly, frequently include megadoses that are much higher than what the body requires. And tingling fingers aren't the only long-term expense. It might be traumatic brain damage, fractured bones, falls, or worse, losing your independence completely. Do you still believe that all vitamins are safe? You should next listen to what occurs when a popular vitamin that you likely believe protects your eyes begins to raise the pressure inside your brain. Vitamin A. Hazard. Excess, Hg, 10,000 IU, can raise intracranial pressure, mimicking stroke. Symptoms. Let's discuss vitamin A. Please let me know in the first remark below if you are still watching and finding these insights useful. Let's go on to point number 4. 4. The vision-improving vitamin A has the ability to covertly increase intracranial pressure. One of those pills that seems harmless, even necessary, is vitamin A. We've heard it's beneficial for skin, immune system function, and eyesight. However, little is known about how excessive vitamin A can suddenly accumulate in the body, raising the pressure inside the skull and, in certain situations, causing a brain emergency that feels like a stroke, particularly in older persons. I will always remember Miss Lillian Moore, a 79-year-old retired Oregon piano teacher. After weeks of getting increasing headaches, dizziness, and impaired vision, she came to see me. Her family initially believed it might be the beginning of dementia. However, they began to worry that she might have a stroke when she began to slur her words and struggled to stay balanced. The MRI revealed increased intracranial pressure, but no clot or bleeding. Her brain's little veins were under tremendous strain, and her spinal fluid was backed up. Neither a tumor nor trauma was the cause. She had been taking the same vitamin A tablet every day for years, which was good for her skin and eyes. This is the issue. Unlike vitamin C or B vitamins, vitamin A is fat-soluble, meaning it stays in your body longer. It builds up in your tissues, liver, and eventually your brain. Seniors are particularly at risk because liver function normally declines with age, and many people add additional vitamins to their multivitamin before realizing it already contains enough for a whole day. A disease known as pseudotumor cerebri, or fake brain tumor, can result from taking too much vitamin A, especially the retinol form, which is present in many supplements. Stroke-like symptoms include headaches, double or blurred vision, nausea, lightheadedness, and in extreme situations, irreversible visual loss or cognitive deterioration. Miss Moore's response astounded me when I asked her how much vitamin A she had been taking. almost 10,000 IU daily for more than 5 years. She had never been warned by a doctor. She believed it to be merely a vitamin. However, months later, she is still regaining her balance and requires routine eye tests and blood pressure checks. It shook her sense of independence, her self-assurance as well. There is no discussion regarding that price, the terror that arises when your body and brain turn on you because of what you thought was secure. The safe upper limit for older persons is approximately 2,500 IU per day, and only in cases of extreme necessity. Anything over that, particularly in the long run, needs to be closely watched by a physician. Do you know what's in that anti-aging or vision-up supporting medication before you reach for it? Is it truly necessary for you? Is your brain silently suffering as a result? Because although vitamin A can help you see better, it can also make the future you're attempting to safeguard less clear. If that causes you to hesitate, wait until you learn about the vitamin that is concealed in heart medications and cereals and has the potential to cause serious cerebral vascular spasms and abruptly increase blood pressure. Niacin concerns. High doses, EOG, 1000 delinolcasm, may cause blood pressure swings and cerebral spasms. Let's discuss Niacin. 5. Niacin, the cholesterol vitamin that can strain your brain and subtly raise your blood pressure. Vitamin B3 or niacin is frequently touted as a natural cholesterol-lowering agent. It can be found in cereals, heart health supplements, and occasionally even prescription drugs. However, the majority of individuals over 60 are unaware that niacin, particularly at large dosages, can cause abrupt blood pressure swings, strain the heart, and narrow blood arteries in the brain, all of which increase the risk of stroke. I will always remember Mr. Dennis Alvarez, an 82-year-old retired Florida postman. He complained of severe facial flushing, chest pounding, and intermittent bouts of vertigo every morning when he came to see me. His wife believed it to be anxiousness. His son speculated that it might be a side effect of his blood pressure medication, but they were all astonished by what we found. Dennis had been taking an online purchased heart-healthy vitamin. It was for circulation and cholesterol. According to the front label, the label on the back, it revealed that each meal taken twice daily contained 1,000 mmol of niacin. That is more than 60 times what a senior is advised to consume each day. This is what was going on within his body. His blood vessels dilated quickly each time he took his niacin, which is why he flushed and felt heated. However, those veins would contract and rebound shortly after. This restriction decreased blood flow to vital parts of his brain, increased blood pressure, and put stress on his heart, which was already aging. This pattern of intermittent pressure eventually became like a hammer on delicate glass, and something would eventually break. A transient ischemic attack, TIG, sometimes referred to as a min-stroke, occurred to Dennis. After 2 minutes of slurred speech, he resumed. He believed it was an anomaly, but I had to be honest with him. His heart was not benefiting from his vitamin regimen. His brain was suffering. Nobody discusses this aspect of niacin. It does more than only decrease cholesterol when taken in large amounts, particularly in those over 65 with high blood pressure or cardiac disorders. It can cause atrial fibrillation, worsen insulin resistance, and narrow cerebral arteries. What's the worst? It can even be purchased without a prescription. Many elderly people take these Megaus pills without realizing it because they believe it's the ethical thing to do. However, the repercussions may change your life. Heart rhythm issues, strokes, and even abrupt drops due to lightheadedness. Now that he is not taking Niacin, Dennis is recuperating under strict observation and happily without any lasting harm. I just wanted to live longer, Doc, he said. I had no idea that I was using my brain as a gaming machine. Read the label if you are taking a supplement for your heart. Look for niacin that is over 50 mg flush-free niacin or time-released niacin. And before you proceed, consult your physician. When it comes to vitamins, the heart and brain are not always in agreement. Speaking of prevention, did you realize that your daily meal may offer greater brain protection than any medication ever could? Let's discuss the safest, most intelligent food choices that can help you prevent strokes completely and assist your brain. Safer food choices. Opt for nutrient-rich foods like leafy greens, fatty fish, berries, nuts, and whole grains. 6. What to substitute. Foods that support brain function without increasing the risk of stroke. Perhaps you're wondering what's left after we've discussed the hidden risks of common vitamins. What's secure? The fact is that your body was not made to be fed by pills. It was designed to flourish on natural, balanced, nutrient-rich diet. Furthermore, the proper diet can minimize the risk of stroke, normalize blood pressure, and protect the brain far more safely for older persons than most supplements ever could. Allow me to introduce you to Mrs. Carol Jennings, a 73-year-old former Arizona school principal. She had a drawer full of medications, a multivitamin, high-doses D for bones, niacin for cholesterol, E for her heart, and additional B vitamins for vitality when she first came to see me. She claimed to be doing everything correctly, Doc, but her blood pressure was rising. She experienced morning vertigo, and she had trouble balancing. Together, we went over each supplement and sorted out the mess. Then, using her plate rather than pills, we devised a strategy. 1 boiled egg, half an avocado on whole grain toast, a few blueberries, and a glass of room-temperature water made up the basic breakfast. She occasionally added a few walnuts, but otherwise she only ate real food with natural nutrients and forms her body could comprehend and absorb. No processed meals, no vitamin cereal. Her blood pressure improved, her energy returned, her thinking felt clearer, and the dizziness subsided in a matter of weeks. Not only did her diet change, but so did the way she fed her mind with what nature intended. Your brain is not a machine that can be tuned up with a pill. Rather, it is a living organ. It requires steady nutrition, healthy fats, hydration, and a gradual release of energy throughout the day. How can I best obtain that? Leafy greens for antioxidants and fats such as kale and spinach. For omega-3s, fatty seafood like salmon are good. Berries for brain cell protecting polyphenols. Nuts and seeds for magnesium and vitamin E. Whole grains to enhance blood flow and balance blood sugar. And keep this in mind if you're still tempted by those supplement bottles, particularly with vitamins. Too much of a good thing can suddenly turn into a danger. I believed those medicines were keeping me alive. Mrs. Jennings later told me they were actually slowing me down. Therefore, start with your meals rather than your medicine cabinet if you're serious about preserving your memory, your equilibrium, and your freedom. After learning the truth about these 5 common vitamins and what to consume in their place, you might be wondering how many seniors are unwittingly putting themselves at risk for stroke every morning by blindly following what they believe to be safe advice. Keep reading because I'll explain why awareness rather than more medication may be your last effective treatment. Final warning. Awareness of vitamin risks is key to preventing strokes in seniors. This is the last warning. The life-saving medication is awareness. You're more than simply a health-conscious person if you've read this far. You're a person who values safeguarding your future, your freedom, and your thinking. And I want to make a clear and honest statement. The medicines you take aren't the problem. The most important thing is what you know about them. For more than 30 years, I have worked as a neurologist. After strokes, I have held stroke patients' hands and observed how difficult it is for families to cope with a loved one who is unable to communicate or remember their name. I have also witnessed strong, talented people lose everything, not as a result of a single major error, but rather of everyday tiny decisions made frequently in the name of maintaining their health. Although they are strong, the vitamins D, E, B6, A and niacin that we have discussed today are not bad. And for that very reason, they need to be respected. Your body doesn't process vitamins the same way it did when you were 30 years old. Your blood vessels, liver and kidneys all become more vulnerable. What used to look innocuous can now cause silent brain vascular damage, raise blood pressure, upset your heart rhythm, or tilt your balance. Unfortunately, the majority of elderly people take these supplements with the best of intentions. They wish to support their partner with strength. They wish to preserve the names of their grandchildren. They want to continue walking, driving, and enjoying their lives as they see fit. Everyone wants that. However, more bottles are not the way to that future. It's increased consciousness. Spend some time reviewing your medication regimen. Examine each label. Consult your physician. Above all, pay attention to your body. Morning, lightheadedness, headaches following the use of vitamins, memory or balance issues. These go beyond aging. These can indicate that your brain is stressed. It's not about fear, remember. It has to do with power, the ability to stop, the authority to inquire, the ability to alter direction before an irreversible event occurs. This is not something you have to do alone. Speak to your loved ones. Talk about what you've discovered. Let this message open someone else's eyes if it opened yours. Because the finest medicine isn't in a bottle. When it comes to brain health and stroke, it's in the choices you start making in the morning. The purpose of these lectures is to encourage you to live life to the fullest and most genuine. I'd be delighted to hear from you now. Think for a moment, then share one item you've learned that you want to use in your own life on this path of accepting these realities. Let's help one another. If this video was enjoyable to you, please leave a remark with one. If not, feel free to use arrow in your comment. Your opinions are very important to us. For more videos like these, remember to subscribe to our YouTube channel, like and share our videos. I appreciate you viewing, and I hope you enjoy living your life as you see fit. This message could save your life if you're over 60. Rarely does a stroke warning signs, sudden arm weakness, speech issues, or loss of balance provide warning. You may feel fine 1 minute and then your arm may not raise, your voice may falter, or your equilibrium may be lost. Neurologist's insight. Many seniors face brain damage from seemingly beneficial vitamins. As a neurologist, I have witnessed far too many elderly people experience brain damage because to something they believed was beneficial vitamins rather than mishaps or poor habits. Vitamin risks. Popular supplements may increase stroke risk if taken excessively. Millions of seniors take supplements every day to increase energy, protect their hearts, or enhance their memory. However, nobody tells you this. Some popular vitamins can suddenly increase your risk of stroke overnight, particularly if taken in excess or at the wrong time. It's possible that your brain is silently suffering even when you believe you're doing something. Video goal. Identify 5 vitamins, D, E, B6, A, niacin, that may cause blood clots, hemorrhages, or blood pressure spikes. Healthy. In this video, I'll identify 5 particular vitamins that may raise your risk of blood clots, brain hemorrhages, or abrupt blood pressure rises, particularly in the early morning when your brain is most susceptible. Safer alternatives. Learn safer brain-protecting options and patient stories. You'll learn what to take in its place to genuinely safeguard your brain, as well as hear first-hand accounts from my patients that are supported by science. The vitamins in your cabinet can be doing more harm than good, so stay with me. Before we begin, I advise you to click the button and activate the bell if you haven't already, so you don't miss any more personalized health advice. Type 1 in the comments if you like this video. If not, input 0 to tell me how I can improve your material. Vitamin D. Danger. Excess e.g. 10,000 IU, can cause calcium buildup, rigid arteries, and stroke risk. The sunlight pill that has the potential to become fatal overnight is vitamin D. It's likely that you have heard that vitamin D is important as you age, good for your mood, and good for your bones. That is only a portion of the story, but it is accurate. The fact that taking too much vitamin D or taking it at the incorrect time might subtly push your brain into dangerous territory and even cause a stroke as you sleep is something that many seniors are unaware of. One of my patients, Mr. Thomas, a 74-year-old retired Navy veteran, comes to mind. He took delight in taking care of his health and was active and vigilant. He took his vitamins with military rigor every morning, including 10,000 IU of vitamin D every day from a high-dose supplement he purchased over the counter. He smiled and replied, "The stronger, the better." It was shielding his bones, he thought. He was unaware that he was gradually putting himself in danger. His wife discovered him one morning weak in his right arm, disoriented and unable to talk effectively. Overnight, he had experienced a silent stroke. His blood pressure was unstable, his arteries were rigid, his calcium levels were dangerously high, and his blood vessels, particularly those in the brain, were under tremendous pressure when we performed his lab work. The offender, toxicities of vitamin D. You see, calcium builds up in the bloodstream when elders take large amounts of vitamin D without a doctor's prescription, especially right before bed. Your body stores the excess calcium in your blood vessels, which causes them to become narrow, rigid, and prone to clotting, since it is unsure of what to do with it. And you know where that clot might end up? Directly to your brain. Our arteries are already becoming less flexible as we age. Dehydration, restless nights, and an evening calcium increase combine to make the perfect storm for stroke. The fact that there are no warnings is what makes it so terrible. You wake up feeling good, but your arm is immobile, your speech is slurred, or your memory is gone. Furthermore, the majority of over-the-counter vitamin D supplements available in the United States are much greater in dosage than what is truly necessary for seniors. Many individuals believe that taking more is better. Therefore, they take 5,000 to 10,000 IU daily. However, if you are not deficient, data indicates that even 2,000 IU per day may be excessive for elderly persons. How much did that error cost? Your speech, your independence, and your capacity to care for your grandchildren, your life perhaps. If you take vitamin D, it's important to have your blood levels checked frequently and to take it in the morning rather than at night, especially if you're also taking calcium or cardiac drugs. Never give yourself large dosages, and don't think that vitamins aren't harmful, because often a seemingly innocuous habit is the one endangering your brain while you sleep. If you were taken aback by that, you won't believe what occurs when you take your morning tablets together with another beneficial vitamin that most people don't even consider. Vitamin E. Risk. High doses, e.g. 800 IU, with blood thinners can lead to brain hemorrhages. Let's discuss vitamin E. Please let me know in the first remark below if you're still watching and finding these insights useful. Let's go on to the second point now. The second is the heart-healthy supplement vitamin E, which has the potential to cause a brain hemorrhage. The majority of seniors take vitamin E because they believe it will improve their immune system, skin, and heart. Yes, it can be helpful when taken at the proper dosage. However, a lot of individuals, particularly those over 65, are unaware that vitamin E can unknowingly turn into one of the most harmful supplements in your medicine cabinet, particularly if you have high blood pressure or are using blood thinners. Mrs. Eleanora James, an 81-year-old retired librarian from Ohio, is one patient I recall clearly. Constantly reading, constantly alert, and as sharp as a tack. Everything was under control because she was taking warfarin for a heart valve problem. However, she added a natural vitamin E capsule that she spotted in a health magazine called 800 IU Daily without notifying her doctor. She told me that I only wanted to improve my circulation and memory. She was taken to the emergency room 3 weeks later due to abrupt confusion, headache, and vomiting. A hemorrhagic stroke or internal bleeding was discovered by a brain scan. Neither trauma nor even uncontrolled blood pressure was the culprit. Her blood was so thinned by the combination of warfarin and high doses of vitamin E that even a little blood vessel in her brain broke. Vitamin E functions as a natural anticoagulant. You see, it might not be a problem when taken by itself. However, it can push your blood's clotting ability over the line when taken with blood thinners like Eliquis or warfarin, as well as drugs like aspirin and Plavix. Additionally, your blood vessels weaken with age. Your life could change forever. With just one small rupture, memory loss is not the only effect of brain hemorrhages. They can take away your capacity to walk, talk, and live on your own. They frequently occur without any prior notice. If you're lucky, you wake up in an ambulance after going to sleep soundly. The fact that many vitamin supplements available in the United States include significantly more vitamin E than is necessary for seniors is even more worrisome. For elderly persons, the recommended daily dosage is only 15 milligmals, or roughly 22 IU. However, the majority of supplements contain 200, 400, or even 1,000 IU, and individuals take them without thinking twice on a daily basis. You may believe it to be innocuous. However, if you are over 65 and using blood thinners each time you take that medication, you are gambling with your brain. Mrs. James lived. She now, however, utilizes a walker. She also has short-term memory problems. I only wanted to assist. Myself, she later told me, crying. I was unaware that I was hurting people. I want to be clear, just because a vitamin is available over the counter doesn't mean it's safe. You should see your doctor before taking supplements if you are taking any medications, particularly those that impact your heart or blood, and you should feel uneasy if you do. What's even more startling, though, over time, a common vitamin used by many older folks for vitality may subtly harm your brain and balance. Let's discuss vitamin B6. Vitamin B6 toxicity, overuse, EDG 100 milligallons may cause nerve damage, numbness, and balance issues. 3. Vitamin B6, the nerve aid that can gradually impair your ability to control your thoughts and equilibrium. You've probably heard that vitamin B6 improves energy, nerve function, or even memory if you're over 60. You might have seen it in a senior brain support bottle at the drugstore or read about it online. However, no one warns you about it. And I know from my own practice that excessive vitamin B6 can harm nerves irreversibly, especially in elderly persons. Allow me to introduce you to Mr. Harold Carter, a 76-year-old Kansas truck driver who is now retired. He complained of numbness in his feet, difficulty balancing, and an odd persistent pins and needles feeling in his hands when he arrived at my clinic. He initially believed it to be a natural aspect of growing older. Then he began to fall once in the restroom and then again. He didn't strike his head until the third fall, and he ended up with a moderate concussion in the emergency room. Something caught my attention as I looked over his prescriptions. For more than a year, he had been taking a high-dose vitamin that supported his nerves every day. According to the label, it promoted brain and circulatory function. However, each tablet had 100 mg of vitamin B6. That is more than 6